Is it like the budgets that the hospitals send to these ministries of finance and the Ministry of Health, it doesn't get approved, or what is really going on with our health system in Ghana?
There's an issue of some of them not being approved, or maybe the ministry not releasing funds on time to meet some of these expenditures. That could be a case, but there are also cases of mismanagement in the government sector. I remember some years ago in the ministry, they did a work to see the kind of waste in the system, and we find a lot of ghost names. These ghost name things they mention is rare, because I was in that meeting when I was doing my national service when they did one in the educational sector, and they found out that there are a lot of people that we are paying them that are not working. Now, so if you just want to blame government that maybe government do not release funds, what about those people that we are using those monies to pay them? So you can blame government on one part. You can also blame management on one part. You can also blame the citizens. Why am I saying the citizens? A lot of people are working and they are not declaring the right taxes they should pay. Few people are paying taxes in Ghana. Very few people are taking the burden. So sometimes if you just want to criticize government that maybe Ghana Health Service or Minister of Health took a budget to the ministry and they do not release funds, the question is that, is the money even there? What we are raising as is it enough? So we are part to be blamed for all these things. There are a lot of people that are evading tax. There are a lot of people that are not paying. There are a lot of people that are doing business. They are earning more than the average civil servant or the average public worker, or even these nurses and doctors we are talking about. But they are not in the tax bracket.
I keep telling people that personally, I believe the whole world, Ghana has the best healthcare system.
Why do you say that?
If it is efficient. See, in our system, no, hospitals can call a buying whole. The government has made it in such a way, hospital I'm talking basically about government facilities. Their finances are managed by the leaders of the hospital. So at the end of the month, we generate income. You have to report it to government and everything. This is what we need to do. Now, that is how they manage the system. But then, a buying doesn't come into the phrase, unya 1,000 there, maybe just say there is and I say fast. They don't tell us that. The hospital governance body, and they're responsible for overseeing, this is how we want to move. And if the facility management were really keen about improvement, these are avoidable situations.
Now me fit a Koribu years heavy. I'm saying Koribu pony. Share the oxygen that my father was on there. Oxygen we know. Yes. Ubaka say we there two mechanic shops. Ja. Now me so I've not been to Koribu before because me I got a hospital or come Peoko. When I go there, so I say I didn't know. So then I say inti Sarah hospital ne wo. So these issues has been there. Panise hospital no manager no in a situation where this issue will not happen. So the bottom line is that I mean, we have seen things. Oh, there's something I can do about it. So go. Go.